Welcome back to the Only You podcast. I'm Barbara Schulte, and we are joined with Dr. Lauro Amezcua-Patino. Thank you very much. Welcome back.
Thank you, Barbie. What are we going to talk about today?
Today we're going to talk about addiction.
Wow.
What a topic.
Yep.
So what is addiction? We hear this word all the time. I think it's a pretty important topic. Pretty much I kind of wanted to discuss what's addiction. You hear this word, addiction, dependence, tolerance. There's a lot of different words that we hear all the time, but what do all these words mean?
Wow, that's a mouthful. Where do I start?
First, let's start. What is addiction?
Addiction is the overuse of substances that's going to lead to dysfunction, right? So in order to be addicted to a substance, you have to be using it frequently. It needs to be affecting your life, your functioning, right?
Okay.
That is very different than dependence.
Yeah.
So addiction is a biopsychosocial process.
Okay.
Dependence is mostly a biological process. So let me explain that to you.
All right.
For example, if you drink alcohol, right? You may drink alcohol to a point that you're addicted to it because it's affecting your day-to-day functioning, but you may or may not be dependent on it.
Why not?
Because dependence requires the process of tolerance. What does that mean?
Mm-hmm.
It means that you've been taking the substance for a period long enough that if you stop taking it suddenly, you're going to have withdrawal symptoms, right?
Mm-hmm.
So that's the dependence part, meaning that biologically speaking, you have a need for the substance, and not having the substance has a biological consequence. So with opiates, there's certain consequences. With alcohol, different consequences. You can say that with certain substances like stimulants, you have different type of consequences. You can move the dependence into addiction by adding the consequences. So what is the use of the substance doing to your life, right?
So when you talk about tolerance, you talk about withdrawal.
Yeah, tolerance usually is manifested by the absence of the substance is going to lead to withdrawal symptoms. So for example, excuse me, when you use alcohol, there's receptors in the brain called the GABA receptors, right? And alcohol actually attaches to GABA receptors. Mm-hmm. And if the alcohol is there for a long period of time, the receptor get used to having the substance there.
Right.
So when you remove the substance, this receptor starts acting out, and that has biological consequences, right? Mm-hmm. Not all substances of abuse or use lead to tolerance. For example, stimulants don't have the tolerance phenomenon because they're not attached to a receptor.
Stimulants being like
amphetamines, cocaine.
Okay. Mm-hmm.
So what happens there is that you're draining other substances. So you can have quasi-withdrawal symptoms without the traditional tolerance. So for example, somebody who's been abusing amphetamines or cocaine for a long period of time, if they stop suddenly, they're going to get very fatigued, moody, irritable because of the absence of those substances that were producing the high, if you may.
Right. So when we're talking about those symptoms, those won't necessarily be life-threatening, but they are uncomfortable.
Well, there's two, depending on the substances you're using. So we can separate them into the alcohol, benzodiazepine, barbiturate class of medications.
Okay.
And then we can use the opiate medications as an example.
Okay.
So when you talk about alcohol, benzodiazepines, or barbiturates, and we don't use barbiturates as much, but in that classification of drugs, most of these medications work in the GABA receptor, so they're going to develop tolerance.
Okay.
And if you use them for a long time and you stop suddenly using them, you can have withdrawal symptoms. In that group, it can be life-threatening. So, for example, if you're coming off alcohol or benzodiazepines, barbiturates, you may develop a very elevated blood pressure. You can develop seizures. You can develop hallucinations, delirium. You can die. Mm-hmm. Right? Opiates, on the other hand, are more dangerous on excessive use than on withdrawal.
Right.
Okay? Because what happens with opiates and excessive use, or use high doses, is that turn off your respiratory centers. So the reason you die with an overdose whether it's accidental or intentional, of opiates is because you stop breathing.
Right. It sends that message to the receptors to slow your breathing down to nothing.
Well, it just turns it off. I mean,
Right.
basically, there's a signal that goes from the brain to the lungs to breathe, right? And that's mediated by levels of oxygen and CO2 and all of that. So that just gets turned off. So, and if you combine opiates with alcohol, benzodiazepines, that effect happens faster. The benzodiazepines and alcohol do not turn off the respiratory centers. Opiates do. Okay, I mean they can, but you have to use doses in which you cannot be awake. So it will have to really be a very severe intoxication. So when you go to withdrawals from opiates, it's very different than what happens here. What happens when you stop taking opiates, whether it's heroin or morphine or Percocets or any of those opiates, they're all the same. When you stop taking them, think of it as if there's water that can come out of your body, it will come out. You know, you're going to have diarrhea, you're going to have vomiting, you're going to have nausea, you're going to be sweating, you know, and then you're going to be shaky and you're going to have water coming out of your nose and your eyes, and then you're going to feel crampy, and it's terribly uncomfortable.
Yeah.
But most of the time, it's not life-threatening. So very few people die from opiate withdrawal, but people can die from alcohol and benzodiazepine withdrawal.
And it has to do, again, with the receptors and all of that.
Exactly. Now, there are other consequences from addiction, right? So because you are using substances, you're biologically dependent, right? It also translates into consequences. So when you're addicted, then you have problems that have to do with taking care of yourself, you know, taking care of other people, interacting socially, interacting in labor like work, interacting with employment and so on. So those interactions are going to force you to go downhill.
Yes,
Okay.
and that's kind of the part I was talking about, where addiction itself has those consequences around, whereas the dependence has those biological consequences that you're referring to.
Correct. So I think that in DSM-5, I think they actually removed the word dependence.
I think so.
And they use use disorder, right?
Right.
Or withdrawal.
Yes.
Okay. So the use disorder that is severe enough of a certain substance is going to lead to withdrawal, which reflects dependence.
Yes.
Right. But the addiction itself, and I don't think that we use the word addiction in DSM-5 anymore either.
No.
I think that what it means is that the whole process of the use of the substance leads to problems in your life, right? So patients that have, let's say, an alcohol use disorder that is severe may require to be hospitalized to be detoxified from the alcohol, and then they need a whole set of treatments to facilitate recovery from the addiction itself.
Right. And then that whole program encompasses all the spheres of their life that were affected by the condition itself.
Well, yeah, I mean, the consequences are not just for the individual that suffers the disorder, but everybody who's around them.
Yes.
So when you have an issue like alcoholism or alcohol use disorder that is severe, the dynamics of that family are going to change.
Yes.
The interaction of that family with the rest of the world, the interaction of the sufferer of the problem with the family is going to be intense and dysfunctional. The ability of that individual to work is going to be seriously impaired. So that creates all kinds of dynamics. And as you and I know, because we work in the hospital all the time, not unusually, it leads to other members of the family having problems.
Yes.
Right. I mean, and because we work with adolescents, we frequently see the dynamics of a child that has grown in an alcoholic environment, or that has grown in a substance abuse environment, or who has sustained the consequences, right? The abuse and neglect that occurs to a child from early age as a result of the the substance abuse.
Now, are these conditions hereditary? Do we see that that condition is passed on?
There is a very strong signal that there is a hereditary component to substance abuse. It's not clear cut though. It's not like if your father suffered from alcoholism, you're going to suffer from the same disorder. But we do see an increased risk.
Mm-hmm.
So when you find that there's a history of substance abuse or alcohol abuse or use disorder in a family, you have to be alert for the risk associated with that. So yes, there's a genetic risk of increased use of drugs or alcohol in families.
Okay. It's not necessarily genetically linked like ADHD or bipolar disorder.
Well, it's complicated because there might be certain genetic changes that you can find in certain groups of people with either alcohol disorders or substance abuse and so on. But it's not clear cut as to say it's like the color of your eyes, right?
Oh, okay.
It's not like that.
Okay.
So it's usually multifactorial with significant impact on psychosocial issues. So why somebody ends up abusing alcohol or abusing drugs is a complex issue. And it's very fast. It's really fascinating, to get into understanding the why. But in my experience in 30 years of dealing with this, it's more about the how than the why.
What do you mean?
Well, we're fascinating in our business with understanding, right? And
Yes.
I want to know why did this person suffer from this?
Yeah.
The problem is that why is kind of overrated because why doesn't necessarily give you the answers into the how to. So I tend to focus a little more on not spending most of my time understanding why, but trying to help the patient understand how do I go about it. Right? So somebody comes and says, well, I suffer from alcoholism because my dad was an alcoholic, and I will say, so what? It doesn't change the fact that you're the one suffering from it and that you have to take care of it. So let's deal with the how to and not with the why.
Right.
But that's no different than you saying, I'm helpless because I have diabetes and I inherited in my family there are lots of diabetics. Okay, fine, but you still have to take care of it.
Right.
Your responsibility on the how you're going to deal with this. And sometimes I may be accused of being non-empathic, about issues like this. But the reality is that, let me give you an example. Patients come and tell me all the time, I promise you, doctor, I will never drink again. And my answer is, so why are you telling me, right?
Yeah. No.
Talk to the mirror, right? Talk to yourself. The only person you need to convince that you're not going to drink is you. Right? The only person you need to convince that you're not going to use drugs is yourself.
Right.
So it doesn't do anything to me whether you drink or not. But it does it to you. It does it to your family. It does it to your job. So hence the only you, right? You have to acknowledge that there is a problem and you have to take the steps that are going to take you to take care of it.
Yeah.
And it's a struggle. There's new tendencies in substance abuse because traditionally we have focused only on total abstinence. And that hasn't worked very well for some people. For some people, it's fascinating. I have patients who have been sober for 30 years going to AA, and for them that worked out very well. But I have patients that have gone to AA for 10 years and they drink all the time. So the question is there a medium treatment? Is there containment? Is it control type of drinking? And that's I think that we're learning a lot from the treatment of cancer, right? In which in some instances of cancer, the focus is no longer to eradicate the cancer.
Control it.
But to control it and allow the person to live a normal life.
Now with they call it MAT treatment, medication-assisted treatment. There's all these new treatment options, naltrexone, Vivitrol, all
Correct.
of these medications that help with cravings specifically and sobriety. I'm not going to get into Suboxone or any of those. Let's just focus on naltrexone and Vivitrol. What are your thoughts on those?
I think they're very useful. I think the medication-assisted treatment is useful to a point. And we don't have panacea treatments, and we can say, take 2 aspirins and call me in the morning. It doesn't work like that. So at best, if you actually look at the studies on naltrexone, it is the percentage reduction of impulsive drinking that is helpful. But it doesn't keep you from drinking per se. So you still have to do the psychosocial rehabilitation process, because one of the problems with medication-assisted treatment is that it gives the misconception that you're being treated. So medication-assisted treatment is not the treatment of alcoholism. It's the treatment of the cravings associated with alcoholism.
Yeah.
But that's no different than saying antidepressants are the treatment of depression. No. Antidepressants are the treatment of the symptoms associated with depression.
Yeah.
Okay, so we have to be very clear on how we explain that to the patients, because sometimes we may give the idea that, well, this is going to take care of the problem.
Right.
And most problems in our business
Yeah.
are biological, psychological, and social. So I always say, any medication-assisted treatment, at best, is going to give you 30% of the treatment. Okay, the other 60% has to come from learning the how to.
Yes.
Right?
So we have the naltrexone. It's a pill form.
And it's also an injection, actually.
And that's the Vivitrol,
Yes.
which is the injectable form, long-term.
30 days.
It helps, and you get an injection every 30 days.
Correct.
And it's supposed to help with cravings.
Yes.
Have you seen it be helpful?
Yes, and I have had patients take it, and I've actually been using naltrexone for a very long time, even before it became popular for alcoholism, because I've used it a lot with kids to reduce impulse control issues, and in some number of kids was very useful. So it's a very safe medication to use, and I think it should be used more often.
Yeah.
I think that it's a fascinating medication. I think we have a lot to learn, but there are also some newer treatments. For example, we use ketamine for the treatment of depression. It seems to be very promising for some other addictive disorders. We have psilocybin, hallucinogens now being used experimentally for the treatment of depression. So we're starting to learn more about some substances that traditionally have been used as drugs of abuse or in other areas of medicine that can be promising for the treatment of addiction and substance use disorders.
Yeah, absolutely. And again, I'm not going to get into all of the medications, the assisted treatment, but there's a lot of different options. And again, like you said, it has to be, or not has to, but it should be in combination with the therapies and the entire aspect of
Yeah, for
treatment.
example, I use buprenorphine and Suboxone since it came out years ago, and when we had limits on the number of patients and things like that were very restrictive. And we have learned a lot, and it's a very useful treatment. And I think that in combination with rehabilitative processes becomes a very useful tool. And I think that now that opiates have become almost voodoo, you're not supposed to talk about them or use them or anything like that. And because of the opiate epidemic, I think that we have found that some of the MAT options have become very useful too.
Yep. And can save some lives, I hope.
Yes.
All right. Any final thoughts on addiction, substance abuse, anything like that?
Well, again, I think that I may not be the most empathic person in terms of feeling sorry for somebody who suffers from addiction, but I think that what people with addiction needs is really some help with the how-to.
Absolutely.
Guidance.
Wonderful.
Okay.
All right. Well, thank you very much.
Thank you, Barbie.
Appreciate you
Appreciate
talking
it.
with us again.
Thank
We'll see
you.
you next time.